Sex Education with NARAL at Pro-Choice Minnesota, state and national healthcare reform in Washington State, the state children's health insurance program in Idaho, and also on the anti-Issue 2 ballot initiative. We also have Suzanne Buckley. She is the executive director at NARAL Pro-Choice North Carolina. Suzanne has over a decade of experience working for reproductive rights and social justice. Suzanne first worked as a political organizer for NARAL Pro-Choice America in 2003. She gained additional political and organizing experience running statewide and down-ballot electoral campaigns in North Carolina. And finally, we have Katie Manis. She is a senior in public and interpersonal communication and psychology. She is also a sister of the Eta Kappa chapter of Delta Gamma. She was a NARAL intern last semester and spoke in January at a Chapel Hill Town Council meeting in favor of the Accurate Health Information for a Stronger Community resolution. Katie is very passionate about women's reproductive rights and fighting deceptive practices of crisis pregnancy centers. So, we will start with the first question. You guys?
We're ready.
Okay. How can you challenge crisis pregnancy centers and pro-life protesters without engaging in the same moral absolutes?
Well, we don't engage with anti-choice folks. You know, we have coalition partners and allies that do clinic escorting to make sure that women get into the clinic safely, without fear and without intimidation. And what was the other part of the question?
How do you not engage in the same moral absolutes?
Is that
I mean, I think that the big difference between the crisis pregnancy center that you saw in the movie and the ones that we have in North Carolina and clinics like Planned Parenthood or A Woman's Choice is that, and you saw it in the film, is that a healthcare provider in a clinic actually talks to a woman about her full range of options and comes from a non-judgmental place. And crisis pregnancy centers, by design and their whole purpose, is to coerce people and present one side of a picture. I mean, you saw the way that they sort of, they literally set themselves on the corner opposite a clinic to try to confuse people. And then when they got them in the building, they sort of put them in a room and showed them this highly propagandized video, and then, tried to wait them out to see, well, okay, if they had an appointment next door, like, let's see if you can keep this, it was like 2 hours or something, before she realized, that she wasn't in the place she thought she was, or by not saying up front and answering the question, like, no, we don't offer abortions. If you walk into a Planned Parenthood, they're going to give you all of your options. They're not there to try to get you to have an abortion. And I think that's the real distinction that this film is about, to try to show you that, one place is a full range of options, providing non-judgmental care, and the other place is being very coercive and deceitful about the way that they talk about these issues and about how they present themselves. And that's really what we're hoping to try to expose through conversations like these, is the difference, so people don't end up accidentally at a propaganda center thinking that they're there to get information about contraception or abortion or adoption or whatever the case may be.
Thank you. Our next question is, how is it that CPCs are able to get away with lying about abortion risks and fetus age?
Yeah, I mean, I think that what we've seen is that they've become more sophisticated over time. I don't know, we have a report that our organization did in 2011. You've probably already seen it, but I think they're out there. Yeah, maybe. They will be if they're not now. That a lot of folks on their website would advertise under abortion services, or would say they provide a full range of options, and then you would go in and you would get all of this propaganda and materials, and they would wait to tell you when you got inside that, oh, actually we don't provide referrals or any information about contraception or abortion care. And so I think we've started to expose that more, and there have been ordinances in California and Maryland, and there's one more state that I'm going to forget. It's kind of hard to name. But an additional state that have said you have to be truthful in your advertising. You have to say and label yourself as what you are. So if you are not an abortion care provider, you can't advertise in the Yellow Pages. way that they're able to use language is very crafty and very sophisticated. So, we're trying to do work at the state level and at the local level to try to expose what actually goes on there. But unfortunately, without the help of our legislature or our attorney general, it's very difficult to get a law crafted that requires them to make certain disclosures. And that's what we were working on at Chapel Hill.
I think also since they're not technically a medical center, they're not monitored as if actual physician's office would be. So no one's double checking what they're really saying or information they're providing.
And it's very hard to document what gets said. And as I'm sure there are studies. Yes, there was a study 30 years ago that linked breast cancer to abortion, but it's been refuted 10 times over. But because that exists out there, they can cite it. Does that mean that it's accurate or that it's scientifically sound? No. But what's the recourse in that? I think is what's what we're running into is who's gonna you all will pay attention and you all might vote for someone who wants to really make sure that is being policed and being regulated. But we need to make that audience much larger before this is going to be an issue that we can really deal with head on.
The next question is, what is the average cost of an abortion compared to raising a child for 18 years?
So, from what we have researched, abortions can cost anywhere from around $300 to around $1,000, depending how far along someone is in their pregnancy. And it looks like at a low ball level, the cost of raising a child from birth to the time that they are 18 is around $111,000. So it's quite significant. The difference is quite significant.
Is it illegal to lure someone to a location under false pretenses?
That's my non-legal opinion. I think you're. I don't know if you don't have to tell me this question was that. But I think that what's going on here is a lot of peer pressure and kind of smoke and mirrors. It's not. They're not putting a sign that says Planned Parenthood right out in front of their clinic because that would be too easily defy the face of a lot of truth in advertising and consumer protection issues. But like he was saying, because they're not regulated by medical standards and safety standards, it's very difficult to kind of find a law that exists already to regulate that without creating another sort of special regulation just for crisis pregnancy centers.
And I have a question in relation to that, because it seems so surprising to me that these aren't regulated at all. To me, an ultrasound looks like a sophisticated, I understand that they're not intervening, but it seems like some kind of medical treatment, procedure that requires some training. And I know some states want to have vaginal wands used, which is invasive. Would they be able to do something like that at these kinds of centers, or would they avoid doing that because they don't? It's not related to getting an abortion, like gaining access to an abortion, which is why those vaginal wands were originally introduced into legislation.
Yeah, I think the purpose of the ultrasounds in this scenario as it started was to try to put a visual image and, like they were saying, a sound, and a picture to the woman's pregnancy. So I think that was the goal there. But I always think of when Katie Holmes was having a baby and Tom Cruise bought an ultrasound machine that he would like take a picture, which I guess that ages me and also shows that I watch Oprah. But that there's nothing that's not a licensed medical procedure in that way. So they've become, as we've started to be able to pass some of the more regulations and laws that kind of try to restrict the behavior and make it more honest and transparent, they've become more and more medicalized. So they would have a physician on staff to do that, but that doesn't necessarily mean that they are a hospital or an abortion clinic, so they don't fall under all these special restrictions that apply to incredibly sophisticated, really systemic plan that has, taken root in cities across the nation to try to, basically create an alternative culture that has taken over and supplanted, abortion care providers. Like they were saying, there's, was it 1 to 4 for every one care provider in North Carolina, we have 4 CPCs. So, it's just sort of, it's a big smoke and mirrors game that isn't working, and that we are not able, at least in this political climate, to do much other than educate people about it. But yeah, one would think if you wear, and they didn't wear lab coats really in this one, but oftentimes, they do, and if you're, and I thought the woman who had the McDonald's was, she was great. It was just sort of like, I know what you're doing, and it's not, and she caught on to it much more quickly, but, the tools that they use